My name is Larry Miller. I'm from Austin, Wisconsin. I was a truck driver for 38 years. I looked at myself as a paid tourist.
Hi.
Good morning. Oh, about 4 million miles. I had no speeding tickets during that time. I had one fender bender in all that time. I enjoyed it. It was a lot of fun. Hey, I'm here to see Dr. Blody.
All right, I'll get you checked in.
Larry Miller.
And this is
Toward the end of my driving career, my eyesight was getting worse yet. And so I thought, oh, I better check this out.
And you are all checked in, Larry.
Okay, thank you.
Thank you.
It looked like a cobweb in my eye, is what it looked like, and I knew something wasn't right.
Look straight ahead out the window there. I take a look here. My name's Dr. David Hoffman, and I'm a family physician, also a boarded geriatrician, and I work here at the UW Medical Center in Boston. A rural part of central Wisconsin, and we serve about 60,000 patients, though we're a town of 4,400, and are sort of a county medical center. And a lot of these patients live in rural parts and communities that do not have an optometrist or do not have an ophthalmologist, and therefore they would have to travel maybe to Madison or Marshfield. Making it convenient and making it available is really important because you can suggest it to the patient, but if it's inconvenient, if it requires having their son take off work to drive them out of the area to another part of the state to have something done, if it's expensive, if it requires an exam with dilating eye drops, which they find uncomfortable, or they can't drive afterwards, they have to have a driver because they're going to be dilated. All of those things are barriers to care.
Well, let's take a look here. My name is Yao Liu. I'm the director of the UW Teleophthalmology program. Everything's looking wonderful. The value of having one's vision in terms of living an independent life, being able to take care of yourself, your family, see all the important milestones of your life. I've often been told by patients that the reason that they most want to protect their sight is to watch their children and their grandchildren grow up. And I think making that possible is just an incredible privilege.
So the camera's going to line itself up.
In our program, we've been working since 2015 with the Mile Bluff Medical Center.
All right, bright flash.
The way the service works, patients can see their primary care physician and that same day get a photograph of their eye that's used to check for diabetic eye disease. And we're looking at the back of this patient's eye. That's something that the American Diabetes Association recommends that people with diabetes get a yearly eye check, either from an in-person exam with an eye doctor or using these photos called teleophthalmology. And another sign of diabetic eye disease. The knowledge that was gained by Dr. Matthew Davis here in our department at the University of Wisconsin back in the 1970s, he led a landmark clinical study showing that 90% of blindness from diabetes could be prevented with early detection and treatment. UW has been a huge leader, not only here in the US, but all around the world in terms of our understanding of diabetic eye disease. And so we're trying to use the Wisconsin idea, make it easier for people to get access to the care they need to protect their vision.
So I'm going to have you bring your chin here, your forehead touching up on top there.
I think it's great. I really do. I'm only 2 miles from the clinic here, so it makes it nice for me. I probably would have went blind in my right eye. I wouldn't have been able to see anything because it was getting to that point. Because all my life I've tried to be an active person or try to be outside and enjoying, the creation around us and everything. And if I couldn't do that, I love to fish. And if I couldn't see a beautiful bluegill, I would be bad situation. Because they can really see what your eye is doing and they can really take care of the problem.
All right, we're all done.
It's been awesome. Actually, in fact, we're trying to expand it. We've had grant money so that we've been able to buy some more cameras. And really, sometimes I think when you say you need to go to an eye doctor, although people shouldn't be intimidated by that, they are. And I've had the good fortune working with and being able to promote it with Dr. Liu coming in and talking about the process and what was being done. And so we're looking at some other sites being able to do it as well. So what we're trying to do is we try to promote things that are healthy for those gender-specific things, women's night or men's night. But as part of that, we've been able to bring the camera, because it's small enough, and be able to actually have people sit down and have photos taken of their eyes, and they can see how easy it is. And really, it's that word of mouth. The need is tremendous. So I think we've just kind of put our toe in the surface of the water of the number of patients that need it.
It's a unique service for the area. Several of my patients have not only diagnosed early diabetic eye disease, but have diagnosed cataracts or diagnosed glaucoma. That's not what the service is designed for, but it's been a side benefit.
There are 30 million people in the US who have diabetes. 1 in 4 will have diabetic eye disease. So it's an incredibly common eye problem, and yet we have lots of wonderful treatments available. As an eye surgeon, I see patients every day whose vision loss could have been prevented just by having their eyes checked. Had their disease been found earlier and treated earlier, could have prevented that blindness from happening.
It's a great example of the Wisconsin idea. And now we're hoping to spread it to other hospitals in the state. This could be expanded to the world. If you're in a third world country with some very limited access to hospitals and equipment, you can bring this equipment, and now with internet links and satellite phones, could transmit this picture back to the university, have the same university level ophthalmologist reading an eye exam from Tanzania as in Madison. So it's really exciting to think that you can offer that level of care to everybody in the world.
Well, that would be good for everybody. To make sure they get their eyes checked, because the eyes are so important. It's one of your senses. I mean, if you enjoy looking at the world and you want to see it better, it doesn't hurt to have it checked to make sure that things are going okay for you.